ਪੀਲ ਖੇਤਰ ਦੇ ਵਿੱਚ ਵੀ ਕੋਵਿਡ-19 ਦੇ ਕੇਸਾਂ ਦੀ ਗਿਣਤੀ ਦੇ ਵਿੱਚ ਲਗਾਤਾਰ ਵਾਧਾ ਹੋ ਰਿਹਾ ਹੈ। ਓਨਟਾਰੀਓ ਦੇ ਹੈਲਥ ਅਫੀਸ਼ੀਅਲਸ ਵੱਲੋਂ ਬੀਤੇ ਦਿਨ ਇਹ ਕਿਹਾ ਗਿਆ ਸੀ ਕਿ ਤੁਸੀਂ ਖਾਸ ਤੌਰ ਤੇ ਕੋਵਿਡ-19 ਦੇ ਕ੍ਰਾਈਸਿਸ ਦੌਰਾਨ ਮਾਰਵਾਨਾ ਜਾਂ ਹੋਰ ਕਿਸੇ ਚੀਜ਼ ਦਾ ਇਸਤੇਮਾਲ ਨਾ ਕਰੋ। ਇਸ ਸੰਬੰਧੀ ਫੀਲਡ ਰੀਜਨ ਦੇ ਇੰਟਰਿਮ ਮੈਡੀਕਲ ਹੈਲਥ ਅਫਸਰ ਡਾਕਟਰ ਲਾਰੈਂਸ ਲੋ ਨੇ ਸਾਡੇ ਸਹਿਯੋਗੀ ਜਸਲੀਨ ਕੌਰ ਨੂੰ ਜਾਣਕਾਰੀ ਦਿੱਤੀ।
Hello, Dr. Lawrence Low. Very warm welcome to PTC Punjabi. My question to you is, number of COVID-19 cases in Peel continues to rise. When will we see a downward shift in cases? What do you think? Where are we lacking in flattening the curve?
Well, no, actually, Jasleen, I actually think that our numbers are very positive. And if anything, it's not increasing at a super fast rate, sort of doubling every day. What we are seeing is there is still an increase, but for a large part, it seems that the increase is slowing down day by day. I'm hopeful that in the next few weeks, if we keep up our strong physical distancing measures that are in place, that we will start to see a flattening. And so overall, our picture is starting to become very positive, but it really speaks to the importance for us to keep staying at home as much as possible. And really only coming out for essential reasons, just at least for a few weeks more.
Dr. Low, is Peel Public Health tracking the cases?
Yes, absolutely. So every single positive case of COVID-19 that is detected for a resident of Peel is reported to the Public Health Department, and we immediately inform that individual. They're usually self-isolating, waiting for the test result anyway, and then we also do an assessment to determine where the individual might have gotten the infection from, and also all the people that they may have come in contact with, so that we can also advise them to self-isolate and also get tested. So every single positive case of COVID-19 that is reported in Peel region is followed up and tracked by the health unit.
During COVID-19 pandemic, we know that doctors and Ontario Health Minister is warning against smoking marijuana or anything. What's your opinion on this?
Well, Jasmine, it's a great question. In general, I recommend that anyone who is smoking, whether it's tobacco or marijuana, should stop. In general, it's one of the best things that you can do for your health, and especially so with COVID-19, because we know that it attacks the lungs, especially in really severe cases. And the suggestion that we've seen from other countries and even here in Canada is that people who have underlying lung disease or who have lung damage from tobacco and marijuana use, they can actually have more severe presentations of COVID-19. So in general, I always tell people not to smoke if they can. It's the best thing to do for your health, and especially so during this pandemic.
My last question to you is that we know British Columbia said that they are flattening the curve, and in May, if the number are decreasing, in May they will relax some restrictions. So do you think Ontario should do this too if the numbers are decreasing or the curve is flattened, or do you think they should not lose the restrictions right now because we may go into second wave then?
Yeah, so in general, I think British Columbia is a bit further ahead in the pandemic than we are. So they are now taking some steps, I believe, to loosen restrictions. We're not there yet in Ontario, and I think it really is up to us to sort of keep up the physical distancing measures for a few weeks more, and then hopefully in the middle of May we can have a bit more of a clear picture as to whether we can start to take similar steps. But right now it's too early to say in Ontario. Though certainly with BC as in Ontario, if we were to do that in the future, we would still have to be carefully tracking every single case and making sure that we're making sure that spread in the community is still being controlled. So that's an important question, and thank you for that one.
All right, thank you so much, Dr. Lawrence Low, for joining us and sharing this information. Stay safe.
Thank you, Jasmine. You as well.
Thank you. Bye.